Hi everybody, today I want to speak about COVID-19, coronavirus. COVID-19 or COVID-2019 or COVID-19 first appeared in the Wuhan in the China in the last December 2019. Coronavirus are enveloped virus, okay? And it has a non-segmented 30 kilobase or 30,000 base, was a positive sense RNA. Okay, and the family of this virus is the coronavirus or coronavirus. This virus, the new virus, it has a 125 nanometer diameter. Okay. Before I study about the coronavirus, I study about the coronavirus family. Okay. We have 4 types of the gene: is alpha, beta, gamma, and delta. Okay, and the coronavirus belongs to the beta COVID genome. Okay, then we have 4 types genome. Then we can write easily COVID-19. Okay, very basic information. Type of the virus is enveloped virus. Okay. And it has a 30,000 or 30 kilobase unit positive RNA. Okay, until here is good. And the diameter is 25 nanometers, is big. And the unit, as you see, the 30 kilobase is the big unit. And also it's from the genome belong to the beta COVID genome. Okay, because we have 4 types: alpha, beta, gamma, delta. Beta mainly between the relation between the human and the animals. Okay, but alpha mainly for the animals. Okay, and we will see later why this is the virus is dangerous, how is the mention, how is the work. This virus can bind to the ACE2 receptor. That's the main important things for us. It can work with the ACE2 receptor. Okay? And you know, the ACE2 receptor mainly we can find in the respiratory, GI tract, and in the kidney. Then, when the virus binds for the receptor and goes inside the cells, okay? In this case, the cells convert to the APC, antigen-presenting cell, and it can stimulate the inflammation process and induce the immune system, and it can cause inflammation and acute respiratory syndrome, and because of this we can say it's a SARS-CoV-2, and we can mention it as a SARS-CoV-2, as you know, because it has a severe acute respiratory syndrome, okay, of the COVID-2. Okay, it's very important because this belongs to the SARS virus. And now, basically we understand what is the relation between them. Okay, it's very important because we have in the beta groups, we have many the types before. For example, we have a MERS-CoV. Okay, it comes from the camel to human, and also we have a alpha, for example, PRCV is for example in the animals, and also we have, for example, gamma, for example, it is IBV and others. The spread of the virus primarily from the nose and the mouth secretion. Okay, in this situation, the nose and the mouth secretion is very important because inside droplet, okay, for example, when we have coughing, sneezing, okay, it can spread in this space, but it's envelope type, okay. Okay, it can spread in the air, and for example, if we have a low distance in the area, the person can get this virus, okay. And also sometimes the touching of the contaminated surface, then face can be affected. For the test, we can use real-time reverse transcription polymerase chain reaction. It's very important from the nasopharyngeal swab. Or in the later step, we have to also check the CT image. It's very important, okay, for the diagnosis. As I mentioned, there is different methods, okay? The first one, PCR, RT-PCR, okay? CT scan, chest CT scan, okay? Also, in the hospital, we can, after, okay, we know the person has the coronavirus, we need a laboratory test mainly in the hospital, because I think that this will help us to save the patient life. Because the last step and which medication can help to protection of the person and stop the progress of illness and decrease the inflammation, it can help us, okay? And the main important things today I want to speak about it. The first step is how the virus enters the cell. The main important thing today I want to speak, how the virus enters the cell. Okay? How the mechanism of genome is very important for us. For example, gene expression and replication, and the replication, and the genome expression, okay? And the third one, RTC, or reverse transcription complex, and the last one is very important for us, is the immunoreaction. Okay, the first step is very important for us, because if we can prevent inside the cell, okay, or decrease the number of the virus into the cell, is very help us. It can help for the patient, and it is very important. How we can know maybe we have a coronavirus? The first step is very important, is the dry cough and fever. The fever is very important because the person has a fever, it has a runny nose, okay, and it has the breathing difficulty, and sometimes it has shortness of the breath, and also sometimes we have a pneumonia and headache, and also diarrhea is one of the important symptoms, because the ACE2 receptor in the GI tracts, when we have a high amount of virus, it can make a diarrhea. And the latest stage is the progressive respiratory failure, and also we will study, is very nice, because I saw in some articles mention about the heart tissue damage, and which is one of the important, because it can cause myocarditis and inflammation in the vessel, and the most important is the coagulation cascade. Is so important, because it can activate the coagulation cascade, because one of the maybe patient has any symptoms, the first steps, and we will see the patient has thrombosis and die because of the coagulation. And I say for this system, and it's very important, and also patient, because of the nerve system effect, it can loss of the smell and taste. It's very important for the recognition of the COVID-19. But the main important things now I want to mention about it in the laboratory test, maybe in the hospital. What we can it is better if we check it because it is very important what we can check it. It is very important. For example, I will mention now as what I wrote here. Okay, when the immune system reaction activation, the important things, the inflammation process increase. The first step is the better we check the CRP, C-reactive protein, and see the patient has a inflammation or no. Okay? And also we can check in the mainly, I saw in the articles, liver enzymes also increase. In this situation, in this case, ALT, LDH, okay, and CPK in the patient increasing. Okay, the patient maybe has a low platelet in the severe case, and leukopenia is very important for the leukopenia. Okay, and now, okay, with this mention and with the CT scan of the chest and with the PCR just shows we have a coronavirus or no, we can see the stage of the illness in the patient, and it is important because maybe it causes liver failure, and also it has a big problem in the coagulation system, and also, as I mentioned, coagulation cascade test is very important. We talk about coagulation. Okay, it's very important. Okay, we have to check prothrombin time and other things for the about this illness. Okay. This is the first step I speak, and in the next video I will continue about the genome structure and how does it work and how is the shape and how the gene expression happen, how to enter the cell, how we can prevent this mechanism, and it will be very easily and it is very useful, I think. I hope it will be good. See you in the next lecture.